Hello and welcome to this week's episode of Clinic Conversations, and this week we are back for round 2 with Dr. Poling, dermatologist here at Rapid City Medical Center. How are you doing today?
Very well. Thanks again, Jack, for inviting me.
Yeah, so today we're going to be talking about another use of PRP and how it's used to help alopecia. So if you want to just kind of reiterate what we talked about last time and what PRP is and how it originated.
PRP stands for platelet-rich plasma. It originated in the early 2000s for wound healing and bone grafting. It's been used extensively in orthopedics and dentistry for those two indications. What has been learned is platelets act as stem cells. They're full of over 30 bioactive proteins that help renew and rejuvenate as well as promote healing and bone growth.
So then do you want to just talk a little bit about what alopecia is?
Alopecia is an umbrella term that means hair loss. There's obviously multiple different causes of hair loss and types of hair loss. The most widely used indication of PRP and alopecia is for one of the most common types of hair loss, which medically is called androgenic hair loss, or what is known as male or female pattern baldness. This often has a genetic component, runs in families, and is certainly common as people get older.
So how is PRP used to treat alopecia, and at what stage of alopecia is it best to see maximum results?
Unlike with cosmetic applications, it's even a newer procedure to use PRP for androgenic alopecia. So extensive review of the medical literature shows many different protocols for treating familial hair loss with PRP. The most widely used and widely studied is done at monthly intervals and then repeated approximately every 6 months. No one really knows why, but females tend to have better response in their alopecia than male patients. And studies are pretty black and white that the earlier the hair loss is treated with PRP, the more successful and the more results patients see.
Okay, so what's the treatment timeline with PRP, and is it quick and easy? What's the frequency that it needs to be repeated, especially with alopecia?
So the process itself is quick and easy and relatively painless. The frequency is typically monthly and then repeated, as I said, every 6 to 12 months. So to see results, however, after PRP for alopecia is typically a little bit slower than it is with cosmetic indications. Typically takes 2 to 3 months. What most of the studies show is a 30 to 40% increase in the texture and the thickness of the hair as well as hair regrowth.
So for alopecia, is it something that the patients need to continue doing after they're seeing a lot of improved results? So in other words, will those results go away if they don't keep up with treatment?
That's a great question, Jack, and I don't think the medical literature really answers that. Most of the studies suggest that annual treatments are necessary to maintain the results, but this is a new enough procedure that I think it's developing science.
So how can patients learn more, and should they come in for a consultation beforehand to figure out the best treatment plan for them? I guess what's the process there?
Absolutely. We strongly recommend a consult either with one of our PAs or one of the doctors. First of all, we need to establish the true cause of the patient's alopecia to see if they're even a candidate for PRP. There are multiple treatment options depending on what exactly is causing the hair loss. So the best way is to call 605-721-DERM, which is 605-721-3376.
Thanks so much.
Thank you.